Hello, and welcome to the first video toolbox talk for SFI compliance. Our nation has experienced some extreme challenges over the last couple weeks, and we've learned a new term, social distancing. With that in mind, a lot of our meetings have been put on hold. At SFI Compliance, we still think toolbox talks are a very important aspect of keeping our workers safe. So we've decided to start a video toolbox talk series. Thank you for joining us today. Today our topic is COVID-19 prevention. We will cover the following topics today: 15 days to slow the spread, site and office procedures, meetings, and close out with confirmed cases. On March 16th, the President and the Coronavirus Task Force laid out a new program called 15 Days to Slow the Spread. Please go to coronavirus.gov to find out more details. We're going to cover a few of those today. First, if you feel sick, stay home. Don't go to work and contact a medical provider. If your children are sick, keep them at home. Do not send them to school. Contact your medical provider. If someone in your household has tested positive for the coronavirus, keep the entire household at home. Do not go to work. Do not go to school. Contact your medical provider. If you are an older person, stay at home and away from other people. If you are a person with serious underlying health condition that can put you at increased risk, for example, a condition that impairs your lung or heart function or weakens your immune system, please stay home and away from other people. These steps can greatly reduce the spread of coronavirus. We all want to do our part to slow the spread of coronavirus. Even if you are young or otherwise healthy, you are at risk and your activities can increase the risk for others. It is critical that you do your part to slow the spread of coronavirus. If possible, work from home. Avoid social gatherings in groups of more than 10 people. Avoid eating or drinking at bars, restaurants, and food courts. Use drive-through, pickup, or delivery options. Avoid discretionary travel, shopping trips, and social visits. Do not visit nursing homes or retirement or long-term care facilities unless to provide critical assistance. And of course, practice good hygiene. Wash your hands, especially after touching any frequently used item or surface. Avoid touching your face. Sneeze or cough into a tissue or the inside of your elbow. And disinfect frequently used items and surfaces as much as possible. These current guidelines from the CDC and the Coronavirus Task Force are very important to help us slow the spread. At this time, construction sites across the nation are still operating. We can keep those operating and keep our workers safe if we can follow some safe work procedures. Please make sure to follow all local, state, and federal recommendations as those change regularly. Make sure your site has plenty of signage and postings. You can find these at coronavirus.gov. There are posters on there in English, Spanish, and other languages. These include how to stop the spread of germs and symptoms to look for with coronavirus. Cleaning should be done on a regular basis for all office areas and frequently touched surfaces throughout the project. Break areas should be spread out. Large areas should be given to our workers so they don't have to congregate in a small area. We have to make sure we're using social distancing for all workers. This means we can't put a lot of workers in one room to finish a task. 6-foot distance is required at all times. And lunch trunks should not be allowed on the project. Meetings are still an important task in order for our projects to keep going. We still need to meet. However, we can follow these guidelines to keep us safe. First, avoid in-person meetings if possible. Follow all social distancing practices if we do have to meet in person. Possibly meet outside, but always maintain 6-foot distance. Video conferences and phone conferences can also be used to meet. Although maybe not as effective in some cases, we can still complete the task. And then finally, review all plans and documents electronically. What if you have a confirmed COVID-19 case at your workplace? First, stop the work in that area. Notify the local health department for guidance. And then finally, clean, disinfect, and notify other interested parties, including your risk department and your legal department. Just because there's a confirmed case does not mean the job site needs to shut down. Thank you for your time today. If you have any questions or comments, you can find us at www.sficompliance.com. You can email those to customer service at sficompliance.com. And our number is 1-800-727-5051. In these challenging times, if we all work together, we can all remain safe. Thank you for your time again. Take care.